In this video by Deck Plate we will be discussing types of diabetes mellitus, some of the most common types of diabetes mellitus experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Different types of diabetes mellitus impacting military veterans. Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes mellitus is a condition that runs rampant among the veteran population. Of those particularly affected is the Vietnam-era community. As these veterans approach the years of wisdom, diabetes has a tendency to creep up alongside them. Following are some conditions that every veteran must know. Hypoglycemic reactions. Hypoglycemia, or a hypo, is an abnormally low level of glucose in your blood, less than 4 millimoles per liter. When your glucose, sugar, level is too low, your body doesn't have enough energy to carry out its activities. Hypoglycemia is most commonly associated with diabetes, and mainly occurs if someone with diabetes takes too much insulin, misses a meal or exercises too hard. Causes of hypoglycemic reactions. Hypoglycemia occurs when your blood sugar, glucose, level falls too low for bodily functions to continue. There are several reasons why this can happen. The most common reason for low blood sugar is a side effect of medications used to treat diabetes. Blood sugar regulation. When you eat, your body breaks down foods into glucose. Glucose, the main energy source for your body, enters the cells with the help of insulin, a hormone produced by your pancreas. Insulin allows the glucose to enter the cells and provide the fuel your cells need. Extra glucose is stored in your liver and muscles in the form of glycogen. When you haven't eaten for several hours and your blood sugar level drops, you will stop producing insulin. Another hormone from your pancreas called glucagon signals your liver to break down the stored glycogen and release glucose into your bloodstream. This keeps your blood sugar within a standard range until you eat again. Your body also has the ability to make glucose. This process occurs mainly in your liver, but also in your kidneys. With prolonged fasting, the body can break down fat stores and use products of fat breakdown as an alternative fuel. Possible causes with diabetes. If you have diabetes, you might not make insulin, type 1 diabetes, or you might be less responsive to it, type 2 diabetes. As a result, glucose builds up in the bloodstream and can reach dangerously high levels. To correct this problem, you might take insulin or other medications to lower blood sugar levels. But too much insulin or other diabetes medications may cause your blood sugar level to drop too much, causing hypoglycemia. Hypoglycemia can also occur if you eat less than usual after taking your regular dose of diabetes medication, or if you exercise more than you typically do. Long-term effects of hypoglycemic reactions. Untreated hypoglycemia can lead to seizure, coma, death. Hypoglycemia can also cause dizziness and weakness, falls, injuries, motor vehicle accidents, greater risk of dementia in older adults. Diagnosis of hypoglycemic reactions. If you have hypoglycemia symptoms, your healthcare provider will likely conduct a physical exam and review your medical history. If you use insulin or another diabetes medication to lower your blood sugar and you have signs and symptoms of hypoglycemia, test your blood sugar levels with a blood glucose meter. If the result shows low blood sugar, under 70 milligrams per deciliter, treat according to your diabetes treatment plan. Keep a record of your blood sugar testing results and how you treated low blood sugar levels so that your healthcare provider can review the information to help adjust your diabetes treatment plan. If you don't use medications known to cause hypoglycemia, your healthcare provider will want to know: what were your signs and symptoms? If you don't have signs and symptoms of hypoglycemia during your initial visit with your healthcare provider, he or she might have you fast overnight or longer. This will allow low blood sugar symptoms to occur so that a diagnosis can be made. It's also possible that you'll need to do an extended fast, up to 72 hours, in a hospital setting. What is your blood sugar level when you're having symptoms? Your health care provider will draw a blood sample to be analyzed in the lab. If your symptoms occur after a meal, the blood sugar tests may be done after you eat. Do your symptoms disappear when blood sugar levels increase? Diabetic peripheral neuropathy. Diabetic neuropathy is a type of nerve damage that can occur if you have diabetes. High blood sugar, glucose, can injure nerves throughout the body. Diabetic neuropathy most often damages nerves in the legs and feet. Causes of diabetic peripheral neuropathy. The exact cause of each type of neuropathy is unknown. Researchers think that over time, uncontrolled high blood sugar damages nerves and interferes with their ability to send signals, leading to diabetic neuropathy. High blood sugar also weakens the walls of the small blood vessels, capillaries, that supply the nerves with oxygen and nutrients. Long-term effects of diabetic peripheral neuropathy. Diabetic neuropathy can cause a number of serious complications, including hypoglycemia unawareness, blood sugar levels below 70 mg per deciliter, 3.9 millimoles per liter, usually cause shakiness, sweating and a fast heartbeat. But people who have autonomic neuropathy may not experience these warning signs. Loss of a toe, foot or leg. Nerve damage can cause a loss of feeling in the feet, so even minor cuts can turn into sores or ulcers without being noticed. In severe cases, an infection can spread to the bone or lead to tissue death. Removal, amputation, of a toe, foot or even part of the leg may be necessary. Urinary tract infections and urinary incontinence. If the nerves that control the bladder are damaged, the bladder may not empty completely when urinating. Bacteria can build up in the bladder and kidneys, causing urinary tract infections. Nerve damage can also affect the ability to feel the need to urinate or to control the muscles that release urine, leading to leakage, incontinence. Sharp drops in blood pressure. Damage to the nerves that control blood flow can affect the body's ability to adjust blood pressure. This can cause a sharp drop in pressure when standing after sitting or lying down, which may lead to lightheadedness and fainting. Digestive problems. If nerve damage occurs in the digestive tract, constipation or diarrhea, or both are possible. Diabetes-related nerve damage can lead to gastroparesis, a condition in which the stomach empties too slowly or not at all. This can cause bloating and indigestion. Sexual dysfunction. Autonomic neuropathy often damages the nerves that affect the sex organs. Men may experience erectile dysfunction. Women may have difficulty with lubrication and arousal. Increased or decreased sweating. Nerve damage can disrupt how the sweat glands work and make it difficult for the body to control its temperature properly. Diagnosis of diabetic peripheral neuropathy. Your healthcare provider can usually diagnose diabetic neuropathy by performing a physical exam and carefully reviewing your symptoms and medical history. Your healthcare provider typically checks your overall muscle strength and tone, tendon reflexes, sensitivity to touch, pain, temperature and vibration. Along with the physical exam, your healthcare provider may perform or order specific tests to help diagnose diabetic neuropathy, such as filament testing. A soft nylon fiber, monofilament, is brushed over areas of your skin to test your sensitivity to touch. Sensory testing. This non-invasive test is used to tell how your nerves respond to vibration and changes in temperature. Nerve conduction testing. This test measures how quickly the nerves in your arms and legs conduct electrical signals. Electromyography, called needle testing. This test is often done along with nerve conduction studies. It measures electrical discharges produced in your muscles. Autonomic testing. Special tests may be done to determine how your blood pressure changes while you are in different positions and whether your sweating is within the standard range. Diabetic nephropathy. Diabetes-related nephropathy is a condition that affects your kidneys. Another name for diabetes-related nephropathy is diabetes-related kidney disease, DKD. Causes of diabetic nephropathy. Diabetic nephropathy happens when diabetes damages blood vessels and other cells in the kidneys. The kidneys have millions of tiny blood vessel clusters called glomeruli. Glomeruli filter waste from the blood. Damage to these blood vessels can lead to diabetic nephropathy. The damage can keep the kidneys from working as they should and lead to kidney failure. Diabetic nephropathy causes. Diabetic nephropathy is a common complication of type 1 and type 2 diabetes. Over time, diabetes that isn't well controlled can damage blood vessels in the kidneys that filter waste from the blood. This can lead to kidney damage and cause high blood pressure. High blood pressure can cause more kidney damage by raising the pressure in the filtering system of the kidneys. Long-term effects of diabetic nephropathy. Complications of diabetic nephropathy can come on slowly over months or years. They may include body fluid buildup. This could lead to swelling in the arms and legs, high blood pressure, or fluid in the lungs, called pulmonary edema. A rise in the levels of the mineral potassium in the blood, called hyperkalemia. Heart and blood vessel disease, also called cardiovascular disease. This could lead to a stroke. Fewer red blood cells to carry oxygen. This condition also is called anemia. Pregnancy complications that carry risks for the pregnant person and the growing fetus. Damage to the kidneys that can't be fixed. This is called end-stage kidney disease. Treatment is either dialysis or a kidney transplant. Diagnosis of diabetic nephropathy. Diabetic nephropathy usually is diagnosed during the regular testing that's part of managing diabetes. Get tested every year if you have type 2 diabetes or have had type 1 diabetes for more than 5 years. Routine screening tests may include urinary albumin test. This test can detect a blood protein called albumin in urine. Typically, the kidneys don't filter albumin out of the blood. Too much albumin in your urine can mean that the kidneys aren't working well. Albumin/creatinine ratio. Creatinine is a chemical waste product that healthy kidneys filter out of the blood. The albumin/creatinine ratio measures how much albumin compared to creatinine is in a urine sample. It shows how well the kidneys are working. Glomerular filtration rate, GFR, the measure of creatinine in a blood sample, may be used to see how quickly the kidneys filter blood. This is called the glomerular filtration rate. A low rate means the kidneys aren't working well. Diabetic retinopathy. Diabetic retinopathy is an eye condition that can cause vision loss and blindness in people who have diabetes. It affects blood vessels in the retina, the light-sensitive layer of tissue in the back of your eye. Causes of diabetic retinopathy. Diabetic retinopathy is caused by high blood sugar due to diabetes. Over time, having too much sugar in your blood can damage your retina, the part of your eye that detects light and sends signals to your brain through a nerve in the back of your eye, optic nerve. Diabetes damages blood vessels all over the body. The damage to your eyes starts when sugar blocks the tiny blood vessels that go to your retina, causing them to leak fluid or bleed. To make up for these blocked blood vessels, your eyes then grow new blood vessels that don't work well. These new blood vessels can leak or bleed easily. Long-term effects of diabetic retinopathy. Diabetic retinopathy can lead to other serious eye conditions. Diabetic macular edema, DME. Over time, about 1 in 15 people with diabetes will develop DME. Happens when blood vessels in the retina leak fluid into the macula, a part of the retina needed for sharp, central vision. This causes blurry vision. Neovascular glaucoma. Diabetic retinopathy can cause abnormal blood vessels to grow out of the retina and block fluid from draining out of the eye. This causes a type of glaucoma, a group of eye diseases that can cause vision loss and blindness. Retinal detachment. Diabetic retinopathy can cause scars to form in the back of your eye. When the scars pull your retina away from the back of your eye, it's called tractional retinal detachment. Diagnosis of diabetic retinopathy. Diabetic retinopathy is best diagnosed with a comprehensive dilated eye exam. For this exam, drops placed in your eyes widen, dilate your pupils to allow your doctor a better view inside your eyes. The drops can cause your close vision to blur until they wear off, several hours later. During the exam, your eye doctor will look for abnormalities in the inside and outside parts of your eyes. Fluorescein angiography. After your eyes are dilated, a dye is injected into a vein in your arm. Then pictures are taken as the dye circulates through your eye's blood vessels. The images can pinpoint blood vessels that are closed, broken, or leaking. Optical coherence tomography, OCT. With this test, pictures provide cross-sectional images of the retina that show the thickness of the retina. This will help determine how much fluid, if any, has leaked into retinal tissue. Later, optical coherence tomography, OCT, exams can be used to monitor how treatment is working. If you were discharged veteran from U.S. military and looking for the compensation you can get for the types of diabetes mellitus, please check out our other video on types of diabetes mellitus with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.